And this is one that I don't know whether it works or not. Just like I don't know whether Kinesio works, but I see a lot of people use it. Okay? Probably not a lot of good evidence in it. Clean shave and spray, and this is for a fresh, sudden injury that you want. You're using the open basket weave to control swelling. That's its whole purpose, is to control swelling. So clean shave, spray, heel and lice pads, and I'm going to follow my same exact procedure, except if you notice I'm way down in my foot, way down almost at the base of the toes. I go right into that heel lock figure of 8. Actually, I don't even do a figure 8, excuse me, I just do the heel lock and then I come up into a spiral. I'm using my long lever principle. And I'm going to start off with an anchor. Sorry, Jared, I'm going to just get a little spot there. Top, and this one just lays on. This is so interesting when you do this, when you have an ankle that's going to swell. This tape strip right here blocks the swelling from going distally. I've seen athletes that didn't take care of things the way they were supposed to, and they end up with their toes swollen like a big toe because there was nothing to restrict the swelling to go distally into the toes. Okay? So that's why that strip is there. It just lays. It's not a tight tensile strip. And then again, you're going to go with your stirrups, and you're going to follow the exact same pattern that we've talked about with our stirrups. The difference is they're not going to cross over up on the front. Remember how I talk about a lot of it? We need the wide and then the narrow, and they should, when you get to your third or fourth strip, they should cross over. We're going to leave an open channel up the front for the open basket weave. That's where it gets its name, is the anterior channel is open. I'm going to go one more. And then I'm going to lace it up, but I'm going to leave an open channel. Look at that, I went inferior to the malleoli. Okay, so that's different. That's almost well, at least a half, if not 3/4 of a strip lower than we usually start with, right? And again, that first one goes to the anchor, but then from there on, you're leaving your anterior channel.
Is there any benefit to doing this versus just a compression?
I'm going to answer that in a few minutes. Hang on. Try to follow your contour. What I often do with this is I enclose a horseshoe. The felt horseshoes that we're trying to manage the swelling under the lateral malleolus. I will enclose that into there.
You could do a horseshoe on both.
You could, but again, the medial doesn't swell typically, so there's not much sense in doing it. And then again, same thing. 48 has the clap.
So you don't get men's basketball.
One could say 48.
And then make it look pretty. You're re-anchoring, covering up your loose ends. So that when you put the sock on, the tape doesn't roll. And so that's your open basket weave. Now, I can't tell you whether there's any evidence that supports this. But the logic, or why we do this, is the thought is that it forces the swelling anteriorly up this channel, which aids in the venous return. I would say, anecdotally and experientially, that when I do this, it seems like I get less swelling. And if I do it right, I also force my swelling out of the area where I don't want it. The nice thing about this is that then, your question was, does this work better than a compression wrap? What I do, again, now that you've ruined my beautiful technique, I'm going to use a 4-inch regular length elastic bandage and do a compression wrap over the top of it. Then, when I want them to ice, I take the wrap off and I just leave the tape job on and I put them in the ice if I don't have the benefit or the ability to ice and elevate. Again, you'll hear a lot of contradiction and kind of conflict about this. If you have an acute, fresh, something swelling, you want to use elevation. You really do. I would say on ankles, I'll put them in this, and then I'll ice them if I didn't have a game ready, for example. I might put them in a cold bucket or a cold whirlpool. Because I don't think when you pack an ice bag on both sides of an ankle, you get the same kind of coverage with the cold. I know Melinda might be able to argue this differently from a therapeutic perspective, but I don't think you get the same cooling or contouring with the ice, getting the whole area like you would in a cold tub or a cold bucket. But again, we'd go with the game ready and we'd use our ice or our elevation along with our ice initially. But if we didn't have that, go in the cold whirlpool, comes out, dry it off, then you throw that wrap back on it. And then they're going with the wrap in it. The nice thing is that you get the stirrups, which controls the calcaneal and the knee, which gives you that little bit of support, so they're not, if they step wrong, there's going to be something there. Again, if it was clean shaven and sprayed, there would be some degree of support there. Then at night, what I do is I take the wrap off, but I leave the tape on. So they're still getting compression all the time, but they don't have that compression wrap over the top, which is the bulk. And at night, when our bodies go into a state of sleep or shock, same thing, it shuts the circulatory mechanism down. We don't have to worry about too much restriction. Okay? So that's an open basket weave, and you use a compression wrap over the top.
The distal anchor, is that pretty tight? Or
No, it's just laid on. Again, that's what I said. You just lay it on because it's going to swell down this way. And so you want to restrict it, but if you put it on too tight, then you're going to restrict it and it's going to cause calf cramping and other problems. So it just lays on. It's amazing how even with little or no tension, it stops that swelling from coming down on the toes. I've seen bad ankles where I just have to massage the swelling out of the toes. And that's, either you've got it, well, I would say that if that has happened, you probably mismanaged it as their healthcare provider. I think that's a fairly safe assumption. Now, sometimes that happens and you're not there as their healthcare provider, and that's a whole different story. But if it's one of your athletes under your care and that injury happened and they get this big old swelling, you probably didn't do what was optimal for the patient.
Or they took everything off.
Or they didn't, or they were a non-compliant patient, exactly right. Could be that as well, Steph. It could be non-compliant, yeah.
Happens.
When you ice in the open basket weave, is it hindering it because you have so many layers of tape that the ice has
How do I answer that?
Porous?
That's probably a better question to ask Melinda. You guys know more about the therapeutic. I mean, I just read an article last week that said we shouldn't be using ice on acute injuries because it inhibits some mechanism which is a part of the healing process and it's detrimental, and so I think my response to that would be, you're going to go ice for about 15 minutes in a cold whirlpool or a cold bucket of ice water. It's going to penetrate really well, and actually the water in the tape will help to even keep it cooler longer. So I think it's probably going to be okay. I don't know enough about the game ready, whether I probably wouldn't use this if I was in a game ready, would maybe be another answer to that, but I just don't know enough about how cold that gets. I like the game ready because it's cold and pressure together. Okay? So you got plenty to practice.